The Prime Minister has never been shy of a photo op with a treat. There have been pies, ice creams, sticks of rock and pasties. But Boris Johnson's tune appears to have changed. And this is why. This was the PM days before he was admitted to intensive care with COVID-19. And he thinks his weight at the time was to blame, so he's lost over a stone. And now he wants the country to do the same.
Policy based on anecdotal experience isn't necessarily wise, but there is robust scientific evidence that obesity is associated with an increased risk of various health conditions, including type 2 diabetes, high blood pressure, heart attack, stroke, and even some cancers. Now there's some evidence that tentatively suggests that obesity is associated with an increased risk of COVID-19 complications and death.
This graph is based on a study of over 19,000 people who had tested positive for COVID-19. It shows the bigger the BMI, or body mass index, the risk of going into intensive care for COVID increases. Someone who is severely obese has over 4 times the risk compared to someone who is normal weight.
Being more obese might allow the inflammation that the virus causes to be more exaggerated, so leading to worse sort of immune response, as it were. Equally, being more overweight also impacts on how the lungs are able to extract oxygen, so that they're actually able to extract less oxygen the more overweight and obese you are over time. It also affects the ability of your blood vessels to deliver oxygen to tissues. It affects how thick your blood is. So one of the things we know about this hyperimmune response is that it actually leads to what's known as microthrombi, i.e. lots of clotting aspects. And if you've already got propensity towards that because you're overweight or obese, then clearly that increases the risk.
There are no trials that show if you lose weight, then you will have a lower risk of getting sick from COVID-19.
Even if it suggests a little bit of truth that BMI to a small extent is relevant, then it would follow that if you're able to lose even 1 or 2 kilograms, or perhaps even not put on weight during this sort of the lockdown or the pandemic, that you might be protecting yourselves.
This graph shows the rate of obesity per 1,000 people in European countries. The UK is among the most obese. COVID-related death comparisons are tricky, but nobody disputes that the UK has anything other than one of Europe's highest rates. And obesity is strongly linked to deprivation. You're almost 50% more likely to be obese if you're in the poorest groups in society compared to the most affluent. Concerns about obesity are hardly new. Public health experts have warned for years that the UK was storing up future health problems.
We need to stop the advertising and marketing and promotion of unhealthy food and stick to promoting healthy food with more fruit and vegetables and less salt, sugar and fat in the foods as far as possible. At the same time, we need to use taxes, and you've seen the very successful soft drink levy in the UK, which has meant that most of the sugar-sweetened drinks have been reformulated with far less sugar in, and also reformulation, that's getting the food industry to gradually take out all the unnecessary sugar and fat and calories in food without the public being involved. You don't actually know that salt's been reduced in all the foods in the last 10 years. We can do the same for sugar and fat and reduce people's calorie intake with the same portion size. And this needs to be properly organised. At the moment, it's a chaotic system.
Boris Johnson has always been instinctively against sin taxes, but this pandemic, including his own experience, has changed so much. And now, all options to reduce obesity may well be on the table.